Good morning, Vivalifers. It's Dr. Kelly OMD. We are back. It is Sunday morning, and I know a lot of people are getting ready for their Sunday service, which will probably be online considering the changes that the federal government, as well as the CDC, and probably your local and state governments have recommended in light of COVID 19. I know a lot of people have been reading about COVID 19 and are affected by COVID 19. And I would like to say it is best for us to follow the recommendations and the guidelines of our state, local governments, as well as our federal government. Um, as well as the guidelines that the CDC is putting out, and your local hospitals have probably been giving you information as well. But the focus should be on the CDC and what they're recommending. The reason why I'm here today, besides to say Happy Sunday and good morning, is because I have seen a deficit of information for women that are pregnant with COVID 19. Um, and this is a very important time because pregnancy can put women at significant risk, although it is a very happy and wonderful experience for most. But we need to make sure we are taking care of them as well. And considering some hospitals have anywhere from five to thousands of deliveries a month, there are a lot of women out here that are currently pregnant. And we want to make sure that their pregnancy continues to be a positive, healthy experience. And that is what our jobs are as healthcare providers, as OBGYNs, midwives, family practitioners, whomever is taking care of that pregnant woman. My name is Dr. Kelly OMD. If you are not aware, I am a board certified OBGYN, and I do focus on high risk populations. And that's not to say that I'm a high risk OBGYN as an MFM or maternal fetal medicine specialist, who I have some great friends who are. That means that the women that I know that tend to be more high risk, I focus on. And in this day and age, that is women of color, and that is women in underserviced areas or populations, that is women that do not have health care, or do not have the type of health care that they need. So I thought it was very important that I would get on here and have that conversation with my friends and colleagues, as well as hopefully you will share this short video with others. And I just wanted to say thank you for doing that. I also have colleagues on here that are OBGYNs at our midwives. So if you have anything to chime in on, you can follow me on YouTube, Viva Life Health Hub, and I'm going live on there as well as on Facebook. So let's go ahead and get started. As you know, COVID 19 is started from an animal source, and however, it's spreading from person to person. It appears that the focus began in China. So the information that I am giving you is from articles that are based in China. So articles that were written by Dr. Chang, as well as another one that just came out by Dr. Liang and Dr. Ganesh. And their names are a little bit difficult for me to say because I have not heard them say it themselves. However, I will add those articles here for you at the end of the conversation so that you can read them for yourself and pass them along. So, as we know, pregnancy is a partial state of what we call immunosuppression. So, that means that you are at higher risk because there are significant physiological changes that go on. So, there's changes with your blood volumes, there's changes with how you respirate or breathe in and breathe out, there's changes in weight. And so that makes women that are pregnant slightly more susceptible to infection. And so we should treat our pregnant women just like we would treat our elderly, as well as our very young, because they are at risk. The information that essentially is coming out is from the WHO, which is the Health Organization, as well as the CDC, and they're getting their primary information really from locations that have had the significant impact, like in China. So these are recommendations from some of our Chinese colleagues. There's also recommendation on the Society for Maternal Fetal Medicine website, as well as the American College of OBGYNs, and like I said, the CDC and the WHO. So there have not been a lot of women that have been pregnant and had significant issue with the COVID virus, and so there are very small case studies, and so are very small reports because we have not had a lot of women with that. However, in the past, we know that there have been other infections that have been associated with pregnant women and viral illnesses, things like SARS, things like MERS. So there is information that is associated with that they are bringing to the COVID-19 care for patients. As far as I know, and as far as has been reported, there have not been any maternal deaths associated with COVID-19. However, this is because we take pregnancy very seriously and we take infection very seriously. So that a lot of times that is because when we have somebody that seems to be sick or has a higher risk for something, we make sure that we bring those women in and we test them and we do a clinical examination on them and make sure that we decrease the likelihood of them progressing further with it. So we take this very seriously. However, as I said, for women that do not have prenatal care or women that are not taken seriously about their prenatal care, that could be difficult for them. So that's why I'm here to let them know what they should be looking out for as they traverse this course. So some of the things that can happen when you have an infection, basically you can have an increased risk of preterm labor as well as preterm rupture of membranes. So that means that you go into labor early or that you break your bag of water early. You can also have, because you may have a fever or something like that going on, then the baby can also have an increased heart rate. So if mommy's heart rate is increased, then the baby can have an increased heart rate as well. And that can also sometimes lead to what we call fetal distress, meaning that when we put you on the monitor or listen to the baby's heart tones, it's either too high or too low. And this is specifically in the third trimester of pregnancy. Um, at this point, we do not have any evidence to say that the transmission from mom to baby is there. So we call that transplacental transmission. At this point, we do not have evidence of that. And as I said, this is constantly changing, as you know. So there may be more information that comes out about that. So the question is, how do we prevent COVID? I know you all know how the COVID has been transmitted, and also how we can prevent it. So transmission essentially is from sharing particles, respiratory particles mainly, coughing, sneezing, touching things that already have the viral load on them from typically coughing, sneezing, or something coming out of your mouth. So droplets, respiratory droplets, and then making contact with other people that have that. There's no evidence that COVID is transferred through having sex, however, sexually transmitted diseases are, so we still need to be appropriately protected for that, because now that everybody's cocooning because they're at home, we know that more people are having intercourse and having those interactions. So please be careful that you manage yourself well for those prevention of sexually transmitted diseases. Back to COVID-19. We know that the incubation period for COVID is about 2 to 14 days. However, before you start showing symptoms, you can actually transmit the virus. At this time, there is no vaccine that is available, and there's no FDA approved antiviral. Although I believe on Friday they recommended that we do an emergency approval of an antiviral that had been in testing. However, at the time of this article, they spoke about that there's, although no vaccination, there is an antiviral that has been used to help decrease the symptoms associated with COVID, and we're going to get to that. It's also recommended that if you are pregnant, and the CDC and the government has recommended that do not travel to certain places, that you do not do that. In my organization, they have stated that have limited all travel outside of your area. So people are hunkering down in their own areas. And the reason for that is, if you've been in that area, then you've been exposed. And if you haven't been in the area, then you could potentially bring in new exposures that people haven't seen in that area. Women with a history of travel to areas that have high risk, Those of clinical suspicion. So if you're having some symptoms, you should contact your primary care or your local COVID-19 hotline so that you can let us know and let them know that you're pregnant, that you have been to these areas, and if you're having symptoms, we need to know that as well. As far as a diagnosis, so there's a lot of clinical diagnostics that go along here, starting with a fever. You can have fatigue, you can have chills, you can have a dry cough, as well as shortness of breath. Now, a lot of people are taking the posture that if you have everything, if you have symptoms, but you don't have a fever or shortness of breath, or you don't feel like it's an emergency, so life, limb, loss of life, then they're recommending that you just go ahead and home quarantine. But the important thing is, I would still, if you're in an organization that needs to know where you are, please let them know. Also, let your family know because we don't want you dealing with things by yourself. The other thing is you need to inform your primary OB provider that you're having these symptoms so they can help decide whether or not they need to bring you in for testing as well as bring you in for any clinical diagnostics. Now, this can start online. So this can start with a virtual appointment unless it's an emergency. And if it's an emergency, shortness of breath, severe chills, fevers, high fevers, then please call first, and then when you call them, let them know that you are pregnant and you're having these symptoms and you would like to be evaluated. Okay. Some other things just for the doctors in the group and even for the patients. You guys are smart. If you're not on your online or virtual health system, please get on there. So everybody is supposed to be on an electronic health record. You should be able to see your health records. Go ahead and utilize that. You may see in a COVID case that you may have, if they've taken your blood and you've been evaluated, you may have white blood cells that are normal or higher, normal or decreased in early stages. Something called your C reactive protein may be increased at the time. You may have your platelets may be a little bit low. So that's something to be aware of, as well as the liver function test may be a little bit elevated. Now, this is important because there's something also called preeclampsia and HELP. Now, in COVID, you don't typically have high blood pressure. However, some of those labs that we check for preeclampsia may be altered a little bit. So we want to make sure that we're getting the right diagnosis when we do this. Also, if you have viral pneumonia, and you're showing symptoms of that, so deep coughs, respiratory distress, shortness of breath, a CT may be recommended for you. And please note that we are not going to recommend things for you that we feel are going to cause you or your baby significant distress or risk. So a CT would be a low risk, but highly valuable diagnostic tool that we can use to help diagnose whether or not you truly have a viral pneumonia. So that would be important for us to know. Also, in evaluating COVID-19, we're going to make sure that we evaluate for other things like, do you have the flu or some other viral illness that could be going on? If you do have COVID-19, there you do have an increased risk of being susceptible to a bacterial infection. So COVID is a viral infection, whereas there's also something called a bacterial infection. And that bacterial infection is what we call a secondary infection. So this comes into important play when we talk about treatment, which we will get to very soon. And I just like to say hi to everybody that is on here and listening. Please forward on to people that are pregnant, considering pregnancy, or recently postpartum when we're talking about COVID-19. And as I said, I'm Dr. Kelly, OMD. I am a board certified OBGYN. I am giving you recommendations based on CDC, the WHO, as well as the Society of Maternal Fetal Medicine, American College of OBGYNs, as well as colleagues that are from or in China that have actually experienced this. When I'm done, I will give you links to all of those things and you can read them for yourself and talk to your local OBGYN or primary care provider in regards to that. So as far as we're going back to making this diagnosis, there are swabs we can also do. So we talked about the clinical diagnostic opportunities as well as the radiologic diagnostic opportunity. Now we're talking about, coming in and getting swabbed. So you've heard about the swabbing that people are doing. Now, if you're not a high-risk patient, they are reserving those swabs for high-risk patients, basically because there are limited resources and we need to manage our resources appropriately. And so the things that the diagnostic standard would be for you to get a PCR a swab with PCR testing for your COVID-19. And basically, what they would do is obtain the swab or sample from your saliva as well as your upper respiratory tract. So that can be sputum, so you can spit it out. If you have a trach in, they can do an endotracheal aspirate and also do a bronchial alveolar lavage. That would be very advanced to do. Also, they're saying you can also get get urine and stool samples as possible. For the most part, people are doing nasal swabs and oral swabs. And typically they're doing this 24 hours apart to see whether or not the virus is truly there. So taking 2 consecutive samples 24 hours apart, typically these people are probably admitted if that's the case, and kind of going from there and using that serology to be able to rule in or out whether or not, using that PCR to be able to rule in or out whether or not that is there. Also, like I said, they will screen for other samples, so RSV, influenza A and B, adenovirus, rhinovirus, SARS, as well as bacterial pneumonia, chlamydia, and mycoplasma. So just making sure that we cover all bases when we do that. So as far as management of patients with COVID-19, so pregnant women that we think has COVID-19 should be isolated and what we call investigated. So that means doing all the testing, observing, putting them on the monitor. So babies get monitored with fetal heart rate monitoring. The recommendation is continuous, taking vital signs. And in doing all of this, all the people that are taking care of the patient should be properly wearing protective eyewear as well as face and body. Okay, so if you see somebody coming in fully gowned up, fully covered, that is why, because they're trying to protect themselves, because you are not the only patient that they have to take care of. Okay, so we're going to typically admit you and place you in an isolation location. And then you will be stratified into whether or not you are mild, meaning that you are symptomatic. So you may have a cough, you may have fever, but you are stable as far as your vital signs. You may also be stated whether it's severe. So if your respiratory rate is greater than 30 respirations or breathing per minute, most women that are pregnant are probably around 18 or 20. So 30 is very high. Also, if your saturation, so when they put that little device on your finger, if it's less than 93%, if they take your blood and they notice that your oxygenation status in your blood or your pH is abnormal, then you would be shown to have you would be stratified as severe. Then critical is when you have shock with organ failure. So that means that different organs are starting to fail. Remember, we talked about those labs. So white blood cell count may be going up significantly high. Your liver function test may be abnormal. Your kidney function test may be abnormal. Your lung function test may be abnormal. So that would be stating that you're critical. And this may require that you actually go on mechanical ventilation. So that means a tube down your throat and something is breathing for you. So in who you would see in your room for this, not only will you see our top nurses, you're going to see your midwife if that is your primary provider, and she's going to manage your like labor, the obstetrician, your high risk OB physician, so a maternal fetal medicine person. You also may see a ICU physician there. So it'll be what we call a multidisciplinary team managing you, an infectious disease doctor. So don't be afraid. There's a lot of people around having discussions. They may not all be in your room, but they will be having discussions about your care. So the next thing that we need to do is talk about, supportive therapy. So if you are not, if you're very mild, you may just have what we call supportive therapy. So that may mean You are just being observed. Your vital signs are being observed. We're making sure that your saturations are fine. And if all that is fine, we're talking about rest. Okay, ladies, pregnant ladies, rest. I know it's hard sometimes, as well as hydration. So making sure you're getting adequate fluids, and it should be water for the most part. Nutritional support. So we need to make sure that you're eating, making sure that your electrolytes are balanced, as well as, like I said, monitoring your vital signs and oxygenation. And as I said, pregnant women, this is not happening to a lot of pregnant women. So we are taking extra special precautions if we find somebody that is pregnant. So just making sure of that. So as far as the antiviral treatment, so in China, okay, and it may be some locations here in the United States, depending on what level hospital you're at and where your resources are. Um, Antiviral treatment has been used to treat COVID-19. COVID-19 is a virus. So just like with the flu that we use Tamiflu with the flu, once we figured out that this is what works for it. So there's antivirals that they have been using in China. And this is lopinavir, Lopinavir, and ritonavir, Ritonavir. If I've said them wrong, please forgive me, but that's why I spelled them for you. And it's a combination therapy. And it's the preferred drug regimen, like I said, in China, and it seems to be safe in pregnancy. The recommended dose is 2 capsules of the combination of lopinavir, ritonavir, and that's a 200 milligram capsule and a 50 milligram capsule. Okay, so you would do 2. It would be a 200 milligram / 50 milligram per capsule. And that capsule, you would do 2 of those capsules. And you would take that orally, and you would nebulize that with an alpha interferon inhaler. And that would be 5 million IU and 2 milliliters of sterile water twice a day. Okay. So the recommended dose, as I said, and you can find this on the CDC or in this article that I'm going to give to you. So that will be listed. Also, there is another drug antiviral called remdesivir, Remsidivir. And somebody can correct me if I'm wrong, but I think that this is the one that's in the United States that they're moving forward with approval. And so this is an anti-malarial drug, and it seems to be promising to help against COVID-19. It is already known to help with SARS-CoV-2 virus in vitro. So that's the virus that causes COVID-19, but that's in vitro, so testing. As far as antibacterial treatment, so when you have a viral infection, you can also have a secondary infection that's a bacterial infection. So antibiotics are indicated if there's evidence of a secondary bacterial infection. Now, if somebody has what we presume is bacterial sepsis, then we definitely recommend going ahead and giving that IV antibiotic. And that IV antibiotic would be recommended as ceftriaxone. And that can be administered while you're waiting results if you think somebody has bacterial sepsis. As far as steroid therapy, so people know in the OBGYN or the obstetrics realm that we use steroids for premature babies. So if we think that the patient is going to deliver prematurely, and this has to be weighed as far as sepsis or infection as well, but we do administer a steroid called betamethasone, 12 milligrams, and we repeat that dose in 24 hours. And that's for patients that we think that are going to deliver prematurely. However, long courses of corticosteroids is not recommended in COVID-19 pneumonia, because it may delay the virus getting cleared. However, if it needs to be used for short-term relief, 3 to 5 days, then you can utilize that, especially when you're talking about severe shortness of breath, decreased oxygenation, and you need to calm down those inflammatory responses for patients. As far as when should you deliver a patient with COVID-19? So you have to think about the severity of the disease and whether or not mom is getting better and is baby getting worse. So you have to weigh those things. So that's an individual decision in regards specifically to COVID-19. Now, it also depends on the other comorbidities that women may have. So if a woman there's guidelines that we have for if somebody's diabetic, preeclamptic, having cardiac disease. So we have to weigh all of those things when we're talking about that. That's why it's so important for us to have a combined multidisciplinary team when we approach a patient with COVID-19 who is pregnant. So like I said, you may see a midwife, a OBGYN, you may see a high-risk OBGYN, you definitely will see a high-risk OBGYN, as well as a ICU doctor, ICU nurses, our infectious disease people, pharmacists, microbiologists, those types of people. They may not all come into your room, but they will be having a discussion about it. The other things that we all need to do when you're pregnant and having this, we will do ultrasounds. So we will make sure that the fluid level around the baby is okay. We'll make sure that the baby is growing appropriately, depending on how long this is going on. And depending on where you are in your pregnancy when you get this. So if you get it for some unfortunate reason early in the pregnancy, then we'll need to follow you out for the rest of the pregnancy because we'll want to know how you both are doing. And that may mean more testing for you, ultrasounds and things of that nature. And as I mentioned, most people are going to get delivered based on obstetric indications unless they are severely ill with the COVID-19. Now, do you have to have a C-section? The answer at this time is no, because we do not think that it's being transmitted vaginally, okay? So most women that had COVID-19 in China did deliver vaginally. I believe there was only 2 that were not, and that was not, none of the babies were infected by the SARS-CoV-2. So it's something to be aware of. You don't need a C-section just because you have COVID. Now, there may be other reasons why, like the baby's not tolerating labor or not progressing in labor, or mom is getting significantly sick, and we need to get the baby out as quickly as possible. So this is the even harder part, the care of the newborn. If a woman is thought to have COVID-19 and she delivers, the recommendation is for them to be separated. And I know that is very important. Having a child, there was nothing like, and I'm getting a little emotional about this, but there was nothing like being able to hold, kiss, touch my baby. However, what we don't want to do is transmit that to your child, and then your child ends up having to be in the NICU for any extended periods of time. So the recommendation is to separate mom, and the separation can be anywhere from 36 hours to 14 days or 17 days. The reason why is because the transmission can occur up to that time. So we want to make sure that the baby doesn't get it. Now, the one positive thing about if you do have to be separated, because of the technology that we have, you can FaceTime and you can Facebook message and Facebook video and all those wonderful things. So you can see your baby, because before, when you had to be separated from your baby, you weren't even able to see your baby. So now we have all these wonderful technologies so you can. The other thing is you will be continued on an isolation ward postpartum, making sure that you're recovering appropriately. The good thing is you can still feed your baby your breast milk. So very important. Now, the hand washing, the breast pump, and everything will need to be very clean. We'll need to have your own breast pump, but you will be able to breastfeed, or at least breast milk feed your baby. So we can get the breast milk and we can transfer that to the baby. Granted, it'll be by a bottle, but hopefully baby, of course, will be lovingly accepted, and you will know you are still taking the best care of your baby if possible. Now, if you choose not to breast milk feed, that is up to you, but we want you to know that it does not appear that the virus is being transmitted through the breast milk. And I think for the most part, that is all I have right now. If anybody has any questions, hey, everybody that's watching, thank you for watching. If anybody has any questions, feel free to go ahead and ask me right now. I know that there's been a lot of people on here and I've missed, and I haven't been able to wave and say hi, but I love you, and I'm doing this because I'm interested. I want to keep my skill set up to date, and I want to do it for my patients who, if you're my patient or you're my friend, you know how I love what I do. I'm just going through my notes just to make sure I have this all right. Oh, one other thing, does COVID cause miscarriage or congenital anomalies? At this time, the data is very limited just because we have a small group of women that have been exposed to COVID-19, mainly overseas. So there is not a lot of information on risk of miscarriage or congenital anomalies. And when they look at the data from SARS, it's reassuring, suggesting that there is no risk of increased fetal loss or congenital anomalies. Ooh. Anything else? I do not think so. I think we covered everything. So if anybody has any questions, feel free to reach out to me, vivalifehealthhub.com. You can reach out to me on Messenger as well as YouTube. But as I'm always going to say, please consult with your primary OBGYN or primary care provider before contacting me. Anything that I say on here is based on research, which I'm going to put at the end of this talk. It is based on medical recommendations from the CDC, the WHO, the ACOG, which is American College of OBGYNs, as well as the Society for Maternal Fetal Medicine, and our expert colleagues out of Asia. I hope everybody has a wonderful day. Take the time to focus on your family, get some rest. Follow the guidelines, try to socially distance yourself from those people you have not been around. And please, if you have been exposed or that you are currently dealing with this, please know that we are praying for you. We know that you will get the best care that is out there. And we know that you are going to recover, and we are going to have as minimal significant effects with COVID-19, because we are all aware and we're all doing what we need to do to keep ourselves and others healthy. I hope you have a wonderful day, and don't forget to do it. Viva life. Bye. Oh, I have a question. Jessica Buford asks, question about women that are breastfeeding. So if you have COVID, the recommendation is for you to be separated from your baby, but you can still give them breast milk. If you don't have COVID and you're breastfeeding, then continue to socially distance yourself. I tell people all the time, if your baby is small enough, baby wear, and go ahead and breastfeed. So that is the recommendation as far as breastfeeding with or without COVID. Thank you, Dana, for forwarding to your friend. I hope that she has a wonderful pregnancy. Do not be anxious for anything. She is in the best hands. Make sure she communicates with her OBGYN. Any other questions? If not, thank you very much. I would also like to thank Dr. Enshanta Jenkins for forwarding me the information about this. Also, Dr. Monica Lutendorf, as well as my beautiful, wonderful MFMs that I work with around the world. So if you have any questions, I will put all of that information in the lines for you. And we do appreciate you. Have a wonderful day. Viva life.